Critical colon cancer symptoms you should never ignore if you're looking to stay ahead of your health. It's crucial to recognize the warning signs of serious conditions early on. In this video, we're diving into critical symptoms of colon cancer that you should never ignore. Colon cancer can often develop silently, so understanding these key symptoms can make a significant difference in early detection and treatment. From unexplained changes in bowel habits to persistent abdominal pain, we'll cover what to watch for and why it's important. Stay informed and proactive about your health, hit the subscribe button, and don't forget to press the bell icon to stay updated with our latest videos. Your health is your greatest asset, and knowledge is your best defense. 1. Unexplained changes in bowel habits. A red flag: sudden and unexplained changes in your bowel habits, such as frequent diarrhea, persistent constipation, or alternating between the two, may indicate a serious issue like colon cancer. These changes can result from a tumor growing in the colon, causing partial obstruction and disrupting normal bowel function. For instance, if you notice your stool is consistently thinner than usual or you feel an urgent need to go without producing much, it could be a sign of a growing mass inside the colon. Even subtle shifts in bowel patterns that persist for weeks should not be ignored, especially if accompanied by other symptoms. Early detection is crucial in managing colon cancer, so consult a healthcare professional if you observe any sustained changes in your bowel habits. 2. Persistent abdominal pain. More than just a stomachache. Chronic abdominal pain or cramping that does not subside over time can be more than just a minor stomachache. It might indicate the presence of colon cancer. Such pain often occurs due to a tumor blocking the intestinal passage or causing pressure on nearby organs, leading to sharp pains, bloating, or cramping that can worsen after meals. Unlike typical digestive discomfort, this pain is usually persistent, recurrent, and may not respond to over-the-counter medications. The pain may vary in intensity and can be accompanied by feelings of fullness or discomfort that is hard to pinpoint. If you experience ongoing or severe abdominal pain, it's important to seek medical advice to rule out serious conditions like colon cancer. 3. Blood in stool. A warning sign of concern: finding blood in your stool is one of the most alarming and significant symptoms of colon cancer. Blood may appear bright red or dark and tarry, depending on its origin within the colon. Bright red blood typically indicates bleeding from the lower part of the colon, while dark, tarry stools suggest bleeding higher up. This bleeding could result from a tumor irritating or damaging the colon lining. While blood in the stool can also be caused by hemorrhoids or other less severe conditions, it should never be ignored, especially if it occurs regularly. Regular screening and early medical consultation are essential when blood is present in the stool, as early detection can significantly improve treatment outcomes. 4. Unexplained weight loss. An alarming indicator: rapid and unexplained weight loss, especially when accompanied by other symptoms, is a red flag for colon cancer. Cancer cells consume a significant amount of the body's energy, causing weight loss even without changes in diet or physical activity. Additionally, a tumor in the colon can cause blockages that affect digestion and nutrient absorption, leading to unintended weight loss. This symptom is particularly concerning if you lose more than 10 pounds in a short period without trying or any obvious reason. If you notice sudden weight loss along with fatigue, loss of appetite, or changes in bowel habits, it is crucial to see a healthcare professional for a thorough evaluation. 5. Chronic fatigue. When tiredness isn't normal, feeling unusually tired or exhausted despite adequate rest may be a symptom of colon cancer. Chronic fatigue is often caused by the body's response to cancer, where it diverts energy to fight the disease. Additionally, internal bleeding caused by a tumor can lead to anemia, reducing the number of red blood cells and causing persistent tiredness, dizziness, or weakness. Unlike typical fatigue from daily activities or lack of sleep, this type of fatigue does not improve with rest and can significantly affect your daily functioning. If you experience unrelenting fatigue that disrupts your normal activities, it's important to consult a doctor to explore underlying causes, including the possibility of colon cancer. 6. Narrow or thin stools. A potential colon cancer clue: changes in the shape or size of your stool, such as consistently narrow or pencil-thin stools, may indicate a blockage in the colon caused by a tumor. As the tumor grows, it can partially obstruct the passageway, resulting in thinner stools. This symptom is often overlooked, but it is an important sign that something may be wrong. While occasional changes in stool shape may not be alarming, persistent occurrences should be taken seriously, especially when accompanied by other symptoms like pain or blood in the stool. Early detection of colon cancer is key to successful treatment, so do not dismiss unusual stool patterns. 7. Frequent bloating and gas. More than digestive issues: regular bloating, excessive gas, or a constant feeling of fullness can be more than just signs of indigestion or gastrointestinal discomfort. They can indicate colon cancer. A tumor in the colon can cause blockages that trap gas in stool, leading to persistent bloating, cramping, and abdominal distension. This feeling may not go away even with over-the-counter medications or dietary changes. Unlike typical gas or bloating that comes and goes, symptoms caused by colon cancer tend to be more severe and consistent. If you experience persistent bloating or abdominal swelling that doesn't resolve, it's essential to seek medical evaluation to rule out serious conditions. 8. Feeling of incomplete evacuation. A subtle but serious sign, a constant sensation that you need to have a bowel movement, even after just going, is a symptom known as tenesmus. This can be caused by a tumor obstructing or irritating the colon, making you feel like your bowel is never fully empty. Even if no stool is passed, this urge can persist and become a frequent, uncomfortable sensation. It may be accompanied by abdominal cramping or pain. While other conditions like irritable bowel syndrome, IBS, can cause similar symptoms, persistent tenesmus, especially with additional symptoms, should not be ignored. It warrants further investigation to rule out colon cancer or other serious conditions. 9. Unrelenting constipation or diarrhea. Warning signs to watch: chronic constipation or persistent diarrhea that does not respond to diet changes or over-the-counter treatments can be an early sign of colon cancer. A tumor growing in the colon can obstruct bowel movements, causing either a backup, constipation, or, conversely, an increase in bowel movement frequency, diarrhea. These symptoms are particularly concerning if they are new, last for more than a few weeks, or are accompanied by other symptoms such as abdominal pain, blood in the stool, or weight loss. Monitoring these changes closely and seeking medical advice promptly can help detect colon cancer in its early stages. 10. Iron deficiency anemia. A symptom that could indicate cancer. Iron deficiency anemia, characterized by low levels of red blood cells, can result from slow, chronic bleeding in the colon caused by a tumor. This bleeding often goes unnoticed because it may not always produce visible blood in the stool. Symptoms of anemia include fatigue, weakness, pale skin, shortness of breath, and dizziness. If you are diagnosed with anemia without a known cause, it's essential to consider colon cancer as a potential underlying reason, especially if you are over the age of 50 or have other risk factors. A blood test can help diagnose anemia, and further investigation can identify the cause, allowing for early intervention and treatment. Thank you for joining us to explore critical symptoms of colon cancer. Your health is invaluable, and recognizing early warning signs can be a game changer in detecting colon cancer before it progresses. Persistent symptoms like unexplained changes in bowel habits, abdominal pain, or blood in the stool should never be ignored, as they could be signals of a serious underlying condition. If you notice any of these signs, seek medical advice promptly for evaluation and potential early intervention. Staying informed and proactive about your health can make all the difference. Don't forget to subscribe to our channel and hit the bell icon to stay updated with our latest videos on health and wellness. We're here to provide you with essential information to help you lead a healthier, more informed life. Thanks for watching, and remember to prioritize